time being 9 o'clock, we'll call the meeting to order. Please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Any changes or additions to the agenda? Motion to approve?
I move to approve the agenda.
Second?
Second.
Any discussion? All in favor?
Aye.
Everyone read the minutes from last week?
Move to approve the minutes from last meeting.
Second.
Any discussion? All in favor?
Aye.
Opposed? Passed. All right, our first go-round, please come forward.
Coming forward. Good morning.
Good morning.
Well, here we are to do the Public Health 2016 Department Review, and if you wouldn't mind if we would just take a minute to let staff introduce themselves, and then we'll quiz you.
And tell what they do.
And tell what they do and maybe how many years they've been with the agency.
Yeah, that'd be great.
Mary Thompson, my 11th year and moved with everything. And my final year and final one.
Oh.
Really?
Very.
Loretta Rose Raven, the financial supervisor, and I've been here almost 20 years.
Wow.
Laura Ullman, I do family health, and I will take over Mary's immunization stuff. I've been here 2.5 years. Charlie Schulte, our home health, almost 11 years. Leah Milby, a county technician, and Heather Murphy, published here 16 years.
Yeah, she's healthcare nurse in about a year and a half.
Mary Zafke, public health nurse. I do family home visiting, some insurance screening, with program that I've been here over 21 years.
Wow.
Diane Sullivan, with coordinator, and I've been here 26 years. City Galveston County Tech, and I've been here 24 years. And Marcia Bauer, home care coordinator, 25.
Lori Biak, home care nurse, I've been here about 2 years.
Oh, that's Wanda.
Bee's been here every week.
For 20 years.
Oh, it's a
Get it,
Loretta.
Mary. That's why we hired you.
I'm sure that's on video too.
Can we have that, can we have a service for Wanda, because she's been here quite a while.
All right, well, with that introduction. Anyway, so I just wanted to mention one thing about the people that we have that work at public health. I mean, you can certainly witness to the many years that they have been in service to Houston County. And, you know, this year in particular, I really do want to make special mention of the fact that, you know, without them, I wouldn't be able to be doing double duty here. They have picked up the slack in areas where generally I would maybe have more involvement. So we owe them an awful lot of thanks and gratitude during this period of time. Besides just the regular things that they do on a day-to-day basis, they really do deserve a lot of really. I don't know how we would do all this without them, and just time and time again, really their commitment and going above and beyond, and just displaying their dedication and their service excellence is something really more than words can say. So they are something.
Thank you. Thank you.
Thanks, all of you.
All right, so on with the review here. I'm just going to make some highlights, and certainly if you've got questions during the time we go through this, please feel free to grill me. The thing that, you know, we're really working for, and I hope next year that we can get this done, but ideally it's really nice to be able to bring this to you before you start looking at the numbers. It really does give you some context and some content rather than just simply looking at the numbers. And I also believe that it really holds us accountable to your constituents, our constituents, and to you, the board, for really how it is that we do our work. And we are giving you some data to look at too. Certainly, there's a lot more data that we could give you, but we tried to do just a really high-level look and some things that we're tracking over time. So, all right, so on page 2, we just start with our mission statement, bringing people together to create a healthy future for everyone, really, in Houston County. Our vision elements there, and our core values, as well as our description of services. This is the same kind of template that we've used in the past. Just a reminder that really the heart of public health work is primary prevention. And sometimes I think we, because we're providing services to individuals, we forget really that community is our client. It's the aggregate population that we're here to serve. So it's just a reminder about that. But, what we really are doing is we're about preventing many people from becoming chronically ill. That's what this is all about. So we continue to look at ways of bringing services and programs with that primary prevention focus in mind. On page 3, we just talk a little bit more about our department structure and our department staffing levels. Again, we've trended some information there from 2012 all the way into estimating what we're going to look at for 2017, and these are the dollars and positions that really are in the current budget that you're looking at for 2017. You can see that there has been obviously some decrease in our staffing. Under support really is that we've decreased there our office support when we had the one person that left went to extension, so that's the decrease that you're witnessing there, as well as some decrease in our home health aides. And again, our home health aides aren't here today for obvious reasons. They're out in the field. Well, not really in the field, but they're out helping people in their homes, I should say. To clarify that. And again, this decrease is really due to the decreasing numbers of our home care clients. So, we staff them as we need them. And we'll be talking a little bit more about home care in just a minute. But anyway, you can see that we're estimating a total of 18.25 for 2017. And again, you can see the salaries and benefits that's attached to that. On page 4, just looking again at some of the things that we did manage to get across the finish line, and again, our time period is short here because this really isn't a full year. We got our department review to you late last year, and we're trying to get it to you earlier and earlier and earlier. So this is compressed, and I think because of that, it's been an awful lot of work done in a short period of time. So looking I'm going to just highlight a few of the accomplishments. Under the grant accomplishments, we have our SHIP grant, and we awarded 10 mini grants this year to our partners, including 7 of those were SHIP and 3 of those were from UCare. There's some really tremendous things that are happening out in each of your commissioner districts. And we can come back at another time and talk really about kind of what things have really gotten again across the finish line. We implemented a new MOFAS, Minnesota Organization of Fetal Alcohol Syndrome grant. That's new for 2016, and that will conclude in 2017. Under some partner accomplishments, another new piece that we took on this year was being the fiscal host for MIC, which is the Minnesota Immunization Information Connection. That's a mouthful. In serving really the 11 Southeast public health agencies in Minnesota. That seems to be going really well, and we're anticipating and hoping for an ongoing relationship with that group for at least through 18, hopefully longer. A couple of bullets down from that, we also began this past year of assisting human services with child protection supervised visitation, and that's an endeavor that we participated with them utilizing our home health aides. So far that's been going really well. Sometimes that provides or really makes a challenge for us as we're trying to navigate the scheduling of that along with their home health aide visits. So again, another extra thing that staff need to kind of take on. This year we also did our first ever cross-jurisdictional agreement with Winona County Public Health for their short-term maternal child health nursing service absence. That went well, really well. I think, again, our staff are to be complimented that they took on those additional duties in addition to what they were doing. We figured out how to navigate, for the most part, the IT part of this so that we could get in and do the charting that was needed to comply with the program requirements. And then the last thing that I would just mention under partner accomplishments is just, you know, we're having now our quarterly joint Fillmore-Houston Board meetings of health, and I mean, I hope that you feel the same way that we do, that that's really going well. It's nice to be able to keep in touch more frequently. It doesn't put us quite so stressed when it comes time to having, you know, things that are needing to be signed and have conversation about things moving forward. So, you know, we're looking forward to continuing that into 17. And then I would just kind of hop down there to the staffing department and financial accomplishments. Many things there that we really have to highlight. Please remember to go on Facebook and like us. You know, we want you to look at our Facebook page. We got a lot of information on there, and we're hoping to pick up some more friends through Facebook. And then I think a really impressive thing that happened this year is just the 2016 CDC, which is a national immunization award that went to our Mary Thompson, our agency, Mary Thompson. And that was really something, I think, to be proud of for Mary and for the agency. And then our audits so far, our UCare and Blue Cross Blue Shield audits, those health plan audits have been going really well, and that's to be on part of our home care nurses that are doing the work in the field. Sometimes those health plan audits can be a little unnerving on top of everything else, but we managed to get it done and to do really well, so staff are to be complimented there. Okay, I'm just going to move forward here, and just again on page 5, and this should look probably similar to the one that we just did in Human Services, but to give you this kind of performance dashboard, really looking at activity indicators and key outcome indicators. And so our activity indicators are on this page, and this really reflects basically just the quantity. Now there's a lot more data that we could put on here, and this is just a really high level view of some of the activities that are done and kind of what we believe is projected for 16 and what we project into 17. You know, some of this is external, much of it is external data that we get from third party, particularly when it comes to some of our home care services. So those first two, under those HH caps that you see there, that's information that's gleaned from an external source. That is not something that we do ourselves. And then you can just, and there's nothing really significant there other than you can see what some of the things that we're tracking and looking at. Let's see if anything else there. So it's just, again, that's just the amount of services that we are providing. On the next page, we talk really more, which is a place where we really do want to lean in, and that's really what are the outcome indicators. What are the things that are happening because of the activities? Where are those places that we really are doing well, and where are those areas sometimes that we really need to lean harder in and to look at? The first two, and again, this is aggregate data. Much of it is aggregate data, meaning that it is our whole community, with the exception of a few of those indicators with regards to the breastfeeding initiation rate for our Houston County WIC participants, and the county estimates, or with the exception of those, and the rest of it really is aggregate data. So those first two that we're looking at are the women receiving prenatal care in the first trimester or at above. We give you a state rate and then the Houston County rate. And you know, we're doing well, but we actually did see a decrease from 14 to 15. And again, because our numbers are so small, sometimes it doesn't take much to impact it one way or the other. Just something certainly worth noting. The percent of Houston County women who smoke during pregnancy at or below the state average. You know, we're higher than what we would like to be, but again, you can see it doesn't take but a few to really make an impact to that data. Minnesota is trending at 10.6. And then the things that just would like to take a little bit more note of, see, we're down into the fifth indicator there, looking at the percent of children ages 24 to 35 months covered by immunization series above the state average. We're doing really well there, and I think that's a real a boon to not only our staff, but also to clinicians in the area. I think it's also speaks well of our regional MIC endeavor that we're involved in, so we're doing well there. Breastfeeding rates for our WIC participants. Again, you can see we're doing really well there in accordance with what's happening in Minnesota. Incidence of Lyme disease, again, is a challenge for us. Again, we talked about this in the past. And again, the 6 for 2016 is just for the first 6 months. And we are challenged by really getting an accurate number because oftentimes they are not doing the serology piece or the blood work. They're just diagnosing on symptoms, and that's not something that ends up being reportable to the state. So it's hard to get a real good number what's really happening, but certainly we know this is way, way, way underreported. Heavily diagnosed, but just way underreported. And then the last 4 are some new numbers that we're including this year. Sometimes we get really challenged with putting together data because we start to track and rely on one data source, and then that goes away. And that was something that happened to us between last year and this year. And oftentimes some of that data that we collect doesn't really have a Minnesota rate to track it to. But nonetheless, it still is an indicator of kind of where we are in some areas where we really need to put some more emphasis. You can see the adults who have achieved moderate exercise 5 days a week. For Houston County, 30.8% of adults have achieved that. Again, county estimates of diabetics among adults over 20. We're at 8.6, slightly higher than the Minnesota rate, and county estimates of overweight, obese among adults over 20 years of age. And again, we're challenged because some of this data comes in after the fact. This is 2014 data. Honestly, that's the most current that we could find that's really related to Houston County, to our population, that we believed was certainly credible. So
What's the CA after that?
the CA is the community assessment that was done from the state on our behalf. Okay, and then again, this is how we presented things in the past with regards to our strategic initiatives and moving forward between just into 17 and to 18. The green I won't spend a lot of time on because those are the things that the strategy has actually been completed, but I think it's really a nice way to reflect the work that has been done and completed. So that's what you will note with regards to the green. The red, if there's a strategy pending, and you can see that we don't have any red at the moment, and then the black is an existing and or a new strategy. So all of the ones that are highlighted in green have been completed, and then I think we're going to just continue right on down to the black, because that's really the new initiatives or the ongoing initiatives to take a look at. Again, looking at continuing on with our health education endeavors with regards to Lyme's, that is really a significant issue in our county. So we are intending to, whenever we can, increase physician awareness, expanding our tick information distribution. And again, we've been working with our folks from La Crosse County that are really doing some eradication efforts and looking at how can we really be keeping on top of what kind of ticks are infesting the area, where are they breeding. There's a lot of information right now that's coming forward that way, so we'll continue on with that effort. Our in-home child and teen screenings, that's something that we had staff trained in last year, and looking at hopefully being able to increase the number that are actually performed in the home. On page 8, the first bullet there, again talking about our home care program and the fiscal and management of staff. Again, you know that we are decreasing in our home care utilization, and we really need to sit down and figure out how we're going to manage that one way or the other. Are we going to continue to limp along and to continue to see a slow decline, or is there just more things that we really want to explore, up to and including getting out of the home care business? We have had some initial conversations with some other area providers to see would they tend and be available to serve people that are in Houston County. We have a couple ideas in mind of some potential providers. And just pulling some of the numbers, just to give you kind of a real high-level view of where we're at. In 2013, we had 160 home care clients, and in 2015, we're down at 114. And so we're continuing to see this slow decline. You know, it's difficult. I mean, I wish I had an answer for you why that was. I mean, I can speculate and give you some anecdotal thoughts on that. I'm thinking, you know, there are more options for people in assisted living kinds of housing, expanded family involvement with folks. And then we've had some simply that have expired, that we haven't picked up any new clients. And so, you know, home care is one of those tricky things, and we're seeing more and more agencies. I think there's probably less than 20 in the state, public health agencies, that actually do continue on with their home care services. So, you know, that number is continuing to decline, and it is something that we need to put on our radar, either, you know, as soon as we can free up some time to be having some more conversations with you, our policymakers, probably to involve certainly HR and that kind of thing, is to decide really which way we're gonna move with this. And that is not a surprise to staff. We have been conversing about that in the past, so that hopefully is not news to anybody that's sitting here. Our Min Choices certified assessor requirements, we're looking again to figure out how we can maybe do some things partnering with Human Services. They need the same type of recertification that we do, and it calls for 45 learning units during this next period of time. And so we're trying to figure out how we can work cross-departmental to, if we're going to get somebody and hire somebody to come in and to do that education, to really do it at the same time, and perhaps even with some of the other counties. But you know, Min Choices in our world sometimes is creating a lot of challenge for us. It's a very lengthy assessment, very lengthy. Would that not be an understatement, staff? It's time consuming, and staff really need to know a lot, kind of the fine tuning of this, and so we're a little bit challenged there, but we're getting it done. The next piece is just continuing on with our regional coordination through the Southeast Minnesota Immunization Connection. That's been a nice piece that we've added, doing the fiscal administration for that. That also has a budget impact for us with bringing in some additional dollars for some clerical duties that we've taken on. And then hopefully this next year, moving into 17, we really need to get back to doing some more in-quality improvement. That has taken a bit of a back seat. But it is something that, you know, as we look at possibly way down the way, if the agency is ever interested in doing an accreditation, we do need to put some more effort and energy into that. Okay, moving on to page 9, I'm going to just mention a couple things here, and that kind of dovetails along with this core competency, the second bullet there, the core competency development for public health professionals. Staff have already completed, and this was actually last year, the first step in that assessment process with the Minnesota Department of Health. Again, it's looking at coming up with a training and a workforce development plan. You know, as new staff come on and some of the more seasoned workers leave, you know, there is a concern kind of nationwide, making sure that we have trained staff, that they're competent in public health competencies. You know, we get a little bit of public health and community health in our education, but it is unique, and it is a specialty, and so that's one of the things that we're looking to lean in a little bit harder into this next year. In the next couple bullets there, the parenting classes, the partners in parenting education. This is a curriculum that's our MCH nurses have been trained in, working with our community education to provide. It's really an evidence-based curriculum, and it's provided to clients in a group setting, so we're looking to work more with ECFE, also having some conversations, again, cross-departmentally with Human Services, to how can we get some of our more high-risk MFIP and DWP people also into some of this group setting. And then the last bullet there is WIC outreach. Again, looking at, we have seen a decrease from some past years, really in the between 2010 and 2015, our WIC participation, we've seen some decrease, a significant decrease actually, 23%. We're looking at some new outreach activities, hoping to increase local participation for those really who are WIC eligible. And we know, not only as a state, but as a country, that only about 60%, a little over 60% of folks who are really eligible for WIC are really taking advantage of that. And a reminder that WIC is a USDA program, and it is nutrition education as well as some food vouchers for some supplemental food products. So it's kind of a high level there. The next couple pages is we just want to describe a little bit about our agency grants and reimbursements. There isn't anything unusual there for 2016. We anticipate the majority of those to be there for 2017. Some of the numbers certainly will reflect some difference. I would like to point out on page 11 under the Minnesota Immunization Information Connection, what we've highlighted there, that $79,000, that comes through the agency, that's not to the agency. And that's part of our fiscal.
Dang.
Yeah, I know, darn. But anyway, it is dollars that are primarily passed through, with the exception of close to that $12,000 that we retain for doing that work. Any questions there on any of our, I know it's fairly rapid here on our grants or reimbursements, or even on the initiatives.
I was wondering, can we get information, data information on people that are treated without the lab work for Lyme's?
That's a good question. I don't know. I mean, we can look to see.
Because I think
just
a lot of
newly
people-
diagnosed.
Yeah.
Yeah.
It was really helpful to have this ahead of time too, because we could read it before you were talking about it. So thank you.
Yeah. Newly diagnosed Lyme's. Okay. And then the last couple of pages there are information from 2015, our revenue and expense recap. We actually like the way that Human Services put together there, so we copied them this time and changed, rather than to give you kind of a year-to-date. Again, that can be a challenge when you're operating on a cash basis. And this really is a recap from 2015. I do want to point out that the little asterisk there that says Other, if you look on page 13, it gives you a definition of all of the things that are included in that Other. So it's everything from phone, postage, publications, dues, professional fees, software support, mileage, lodging, supplies, furniture, and fixture. So if you wonder why some of those look bigger than others, you can see that some of those categories are more heavily laden, perhaps, particularly with local levy dollars. We've given you a breakdown, and again, that local levy under the revenue, that local levy is really just for each of that area. So when you get to page 13, at the bottom line there, you can see our total expenditures and then our total revenue and where that comes from. Federal, state, and fees is 91%, and then our local levy contribution is 9%. And I think for an agency this size, that is really awesome, that it is nearly 9% for the amount of, and the volume and the type of services that we're able to deliver for Houston County. You can see that the national average there is somewhere between $5 to $11, with some of the smaller agencies historically being higher, obviously because of our administrative expenses. So we came in right at $7.96 per capita per person in public health services for Houston County, and that's strictly levy. Comes in for levy money. So, any questions on that? Comments? Make sense?
Makes a lot of
Hopefully it's
sense.
helpful.
Thank you very much
Thank
for this,
you.
and thanks for coming in, because it really does help when we get to see you guys and
helps
We
when I
read
get
your
to see
names,
you.
but we don't ever see you.
And if I just have one more minute, I just want to do my infomercial. So this weekend is the Caledonia Balloon Rally and Wild Turkey Fest, and hopefully you've seen these spread all over town, and you're going to be coming to all of these events. That we've been a really active partner at the table in this initiative and endeavor, and it's, I think, really, I don't want it to be lost on, we have some staff that have leaned in hard to this endeavor, and particularly, we talked about the Walk Your City Caledonia map. That started this summer with our student intern, and we are ready to roll it out. So we've got the glossy prints coming that have been ordered, and we're going to be distributing throughout the city, and our ribbon cutting is at 12:30 on Saturday, and we hope that if you're in the area that you will take that opportunity to come and visit. We are also going to use that as an opportunity to do some outreach, so we'll have lots of information that'll be available for folks, and this activity is also being coordinated with the library. They're going to be doing a storybook walk during that time for small kids, and concluding at the library with free books for those families that have participated. And hopefully we'll shuffle people over to the gazebo park where there's all kinds of things happening. But this endeavor has been, really pretty time consuming for the last 6 months, and it has been an endeavor that we have partnered with the City of Caledonia, as well as the Maycal Golf Course. And it really is our attempt to get people out and moving, and particularly young families, and to get them out and moving in a really safe way. We are challenged a bit in Caledonia because of some of the sidewalks, or where there aren't sidewalks. So it has taken significant effort to really define where those areas are that we're really wanting to have folks be out and moving. Hopefully next year, by the time that we're kind of going to be involved again in this endeavor, we will have geocaching associated. Not that I know a lot about geocaching, but there is kind of some folks that are very interested in that, and we would have some of that along the routes in the Walk Your City. And finally, we're hoping that we will be able to put together a toolkit for other cities in Houston County that are interested in doing their own Walk Your City. Houston, Walk Your City. Of course, Spring Grove is maybe a little bit ahead of the curve here on this. But anyway, we're willing to work with our partners, and this is really kind of our pilot. Signage will go up when? Hopefully, when we get the signs. When we get the signs, we're waiting for the signs. We're going to get 2 trails identified before Saturday. That would be the Warrior Trail and the Gazebo Trail. And we might be a little bit behind on putting up some of the rest of the signage, but it's coming. I promise you it's coming. So,
Awesome.
Anyway, that's it. I'll leave some brochures here so that you can take a look at the final copy. So. And Steve, I believe you're going to be
Yes.
able to attend. We'll have Bob Burns from the city who will also be there for the ribbon cutting.
Thank you.
Thank you.
Anybody wants more of these? We have a lot of these left. Pass them out to your family and friends. Expect to see you there.
The Crescent had it on their,
Yeah, it's been kind of all over.
on their thing that came out. I thought that was really
Yeah,
good.
yeah, there's been
Have
some
you
nice
started
pictures.
flu shots yet?
Yes, we have started
Okay,
flu shots.
thank you.
Thank you for asking.
Can I get mine?
Thank you for your time.
Thank you.
Thanks, all of you.
I got you. Before I get done with my turn. Before I get done with my turn.
Well, we better have it before it's January.
Carol, do you want to? Oh, Tess is right behind you. She's coming in. Oh, never mind. Carol's up first. Come on up. Sorry. No, just come on up.
You've had a couple weeks to pour over the third quarter financial report.
Mhm.
And as you can see, it is getting to be quite colorful. We do have a lot of revenues that are green, a lot of expenditures that are red, but bottom line is that we're pretty even. 82%. When we look at all the county, the mixed funds, actually we're at 64%, with 75% of the year our revenues and expenditures are both at that mark. So it's a typical year, well, third quarter. Some of the revenues will be getting posted now in the fourth quarter, and that will even things out. We will have people making purchases that they've saved until the end of the year to make sure that they did have enough money to cover it. Did anyone have any questions about anyone in particular? Anything in particular?
Look pretty typical for this time of the year.
Like I said, it's getting to be pretty colorful, and it's good to see the greens and the revenues being over what we projected, because that will make our budget deficit a little less, and we will make budget adjustments towards the end of the year so that when it comes time to doing our audit, we don't have to explain budget variances, because we'll know what they're going to be.
Do we have to approve the audit report that we got from the state, that book that we all received in the mail?
No.
Okay.
We don't have to approve it, but that's what I was just going to go through next. Any other questions about the quarter end financial? Right, so you probably received did everyone receive their
Yes.
audit report in the mail?
Yes.
And it will be posted to the website. I sent it off to them to have it posted. We had our exit meeting, and Judy was there for a portion of it, and that is where they go through. We did receive an unmodified opinion, which is the highest opinion you could receive. It's not to say that we didn't have things that we need to look at. On page 88 of the report starts the information that they provide and items that they've looked at, what they call findings, things that we need to look at in our audit. These are the actual written findings. We also went through some oral findings, and many of them have to do with the fact that we are a small county. We have to make sure we have segregation
Check
of
and
duty,
balance,
but also have people who know what's going on in each of the departments. So we'll take a look at those also. We'll try to work on these. I think the thing that's been on here the longest is a disaster recovery plan. And it's not just a disaster recovery plan, it's a continuation of operations plan that we're looking at through the safety committee. The next meeting will be in January, and we'll request that each of the departments have their sheets filled out as to what they would do, what's the most important thing in their department that would need to happen during a disaster. So it's not actually just dealing with our data, it's dealing with the whole operation of the county. So I think that finding.
So are we pretty close to having that ready? I know a lot of the departments had theirs
We'll pull it
finished.
together in January and see where we're at.
Okay.
But
And
this
they all,
began in
and everybody
2001.
knows that's their deadline for it.
Well, we
right?
were gonna have it in October, but then we had the safety stuff instead, so we'll send out a notice to bring it to that January meeting. But it began in 2001 when we had this finding, and it's pretty typical. If you go online to the Secretary of State's office and look at the audits of other counties, many of them still have that on there also.
Right.
And it's not that we don't know what we do in a disaster, or like a data thing, because we have set up all the backups, and Andy has all the different areas where backups are done, so we can pull our data back, but how do we get to that point?
Plus it has to all be written out and
Mhm.
in the file, yeah.
Mhm.
Which is a good idea with all of
Mhm.
them.
So then they also did provide the sheets that show the graphs and the
Mhm.
different trends in our net position, our revenues, our expenditures, our capital assets, how they all tie together.
Mhm.
It's kind of interesting to see. I think the biggest impact that we have is actually like the highway department with how many projects they do in a year.
Mhm.
You know, it kind of trends our state revenue, if it's a federal project, that kind of trends it. It also affects our capital assets because the road is actually listed as a capital asset then when it's completed. So they do kind
Mhm.
of have a big impact on how these reports play out. Anyone have any questions on those?
I wanted to ask you also about, when I go to these joint powers meeting, we always have, because they all get the audit reports.
Mhm.
But you know, quite a few counties do have independent auditors rather than the state. Have we ever looked into that?
We have not. It's actually like a 3-year cycle, and we would have had to make a request earlier this year to like say go out on bid for private auditors. So we'll be able to make that request in 2018 because it is a 2-year cycle.
So we have like a 3-year contract right now with the
Right.
state.
Mhm.
I know like Fillmore County, they have another auditor other than the state.
They do, and there are other counties
Quite a
who,
few are
you know,
going that way.
well, and there was just legislation that really more allowed it.
I know. They've been doing it though, a lot of states.
Right.
Counties,
There were
I
a
mean.
certain number of counties who are allowed each year to do it.
Oh,
Now it's
okay.
more the county's choice in this thing. We don't have to have the state auditor's office say, okay, you can.
Oh, okay.
Mhm.
But we can't do it for 3 years.
Right. In 2018, we'll make the request.
Okay.
So it would be for the 2019 audit.
It's been a considerable savings for some counties.
It is,
Depends upon what's available to them for the audit. You know,
Right.
like how far people are coming to do the audit
To
too
do
has
the
a big
audit
bearing
and-
on it.
kind of the depth of the audit.
Mm-hmm.
You know, the state auditor's office basically follows the letter of
Mm-hmm.
what is recommended for an audit. And there are some that like the private auditors because they don't maybe go into that much depth. They also provide us
But
with.
the report goes to the state anyway.
Mhm. It
So-
does, and if the state doesn't like it, then if they don't feel, which I think will probably be becoming more the case, where they would require more information, and they would have to go more in depth. And the state auditor's office provides us, being a small county, with a lot of guidance. They provide their spreadsheets that we use that all link together, and we don't have to figure out how to make that all work, and it does work out very well. We can call them on any occasion and say, what should we
I
do
thought you were
with this?
teaching them.
Mhm. Sometimes we do. I remember when the whole calculation for the tax rates went through, and we sat down and they said, well, explain how this works. And I was going through it, and I finally looked up and I said, and I'm teaching you this because you really don't know this, do you? And they said, that's right. Okay, well, can I bill you?
Yeah.
Mhm. But it works out well. They're a good audit team, and they don't know what's happening either because Rebecca Otto is filing an appeal
Right.
for the legislation that was passed. So they've had many auditors leaving because they don't know what it is. So at some point, they may not even have auditors to provide audit services. And they have to be self-sufficient. They don't take general revenues to pay for the state auditor's office. It all is through billed fees. So,
I just know other counties had considerable savings going with independent auditors.
Mhm.
I mean, it's worth looking into.
Mhm.
And I know there's also been concerns with when we get the bill, it's not really itemized, you know.
Oh, we can request it.
Pardon?
We can request an itemization at any time, but we pretty much know when they've been here, when they've requested information, the time that they've spent.
Okay.
I mean, if there was anything really out of line. we
Has our
would-
cost for the audit gone up much or not
No.
really? Okay.
And, you know, as we get going, we're using this new software package, and as we get more knowledgeable in it, the less time they have to spend looking for things too. So
Okay.
it decreases the time that they have to spend on the audit.
Good. Okay. Thank you.
I have been contacted actually by a couple different places, and one is the Ehlers, which we use for our bonding, that there may be an opportunity for some refunding, discounting of the bonds that we have, which may not in the maybe immediate future reduce our bond payments, but maybe after, is it 4 or 5 years, our payments would be reduced. And I just wanted to see if that was something that you were interested in looking at. We've kind of put it on hold because of the highway department not knowing exactly what we were gonna do then, but it might not be a bad idea just to find out what's available. If we schedule them to come for a meeting.
If it's gonna lower costs, yep, I think we should be looking.
Okay. I'll get a hold of Bruce and have him come in.
Sounds good. More
Work
information.
with Shar and see when there's a time available, what he's got. All right,
Thank you.
thank you.
Ms. Kruger?
Morning, Commissioners.
Morning.
Council. I have a very short agenda for you this morning. I apologize for the late addition. We just received the information Friday. So, at this time, we're requesting a change of classification of rate of pay for Randy Hungerhold, who's a highway maintenance specialist. He's currently at a step 3, an hourly rate of $22.23 per hour. The request we have is due to a change of license, and that this individual be paid in the classification of a laborer at step 3, which is $18.89 per hour, effective October 24th, 2016. This request for a change of classification, we request that it remain in effect until such time that the state or federal revocation of CDLA has expired and the Class A CDL has been reinstated. And then we would come back to the board at that time. And we have worked out all the details, both with the union as well as with the work for the county, and feel that this is in the best interest of the county at this time.
Any questions?
Motion to approve the reclassification from, was it 2223? Is that what the number was? Did I write that down
A
right?
maintenance specialist, step 3, to a laborer, step 3.
Got that, Michelle? Okay.
Second that motion.
Any discussion? All in favor?
Aye.
Opposed? Motion carries.
Thank you, Commissioners.
Thank
Thanks
you.
for coming in. And now if we can get a motion to approve putting the consent agenda item on, it's regards to the USDA responding to Houston County's request for funding under Emergency Watershed Protection Plan.
Move to approve consent agenda.
Is there a second?
I'll second.
All in favor?
Aye.
Opposed? Motion carries. Let's go for commissioner reports real quick. Dana, would you like to start?
Oh, yeah. Last week, on Friday, I attended the
Sylvia Sand DNR meeting in Orinoco. I was there with Rick Frank and Aaron and one of the planning and zoning commissioners, Larry Hafner. And it was a very good meeting. It was more of a fact-finding thing for the DNR to find out what the counties were doing and how they're going to implement different things. I'm glad I went. I was the only commissioner there, but I'm glad I went. I learned a lot. If you have any more questions about it, ask Aaron about it. He took a lot of notes.
Oh, good. We should have that. But it was mainly for them to collect
Yeah, it
information.
was mainly for that. The DNR was asking there's a lot of the people like Rick Franks. There's a guy from Winona and Waseca County, and it was all their people.
Okay.
They had a lot of good questions. I just sat back and observed.
And listen.
Yep.
I didn't have any county meetings. I did attend the dedication in La Crescent with the chamber and the city with the new assisted living. It's going to have a memory loss, assisted living, and independent living complex they're building in La Crescent. So that was very good, except it poured.
Rain for
Rain, you know.
Is that a completed structure or is that?
It's just started groundbreaking.
Oh, groundbreaking, okay.
That's it.
Mhm.
No meetings, just a bunch of phone calls dealing with a possible septic line dispute. So I've been working on that one, but other than that, that's about it.
Septic line?
Where the drain field goes, guy's concerned that it's across the property line, so.
For the county?
No,
For
private.
a private?
Between two,
Oh.
yeah.
Two properties.
Okay. Well, that could probably be a problem.
Yeah. I had no meetings.
I didn't have any meetings. I just went in and observed FEMA when they were here, getting the reports from the township. And we hopefully will be getting the governor to go for the federal because we're at 14,000. So it was interesting to observe the process.
Did quite a few townships put in?
Every township that had
Any
losses
damage?
were there.
Good.
And I can't remember how many it was, but it was a long process, but they know what they're doing because they've done it before, which makes it a lot smoother process, so.
Sadly.
Yeah, it was interesting.
I hope we get the roads. Especially the townships need it.
Yeah. Do we have a motion to approve claims, human services, and license center disbursements?
I so move.
Is there a second?
I'll second it.
Any discussion? All in favor?
Aye.
Opposed? Motion carries. Consider reappointment of Bob Muro, is that how you say it?
Mhm.
To the Soil and
Crooked
Water,
Creek.
Crooked Creek Watershed
Mhm.
Soil District.
I'll make that motion.
Do we have a second?
I'll second it.
All in favor?
Aye.
Opposed? Motion carries. Did you get any more information on this?
Yes, I had correspondence with Dave Walter, and he said there's not a big rush. Val Green is out for the week,
Mhm.
working in another area. So once they talk and know exactly what's what, then we'll talk more
Okay,
about this.
because when Val talked about it, it sounded like we weren't going to have to pay
Yeah, it
for
sounded
the
like they
trees.
donated it.
Like they
Correct.
donated it as an Arbor Day project, so we'll just wait until she's back and we'll
Yeah.
talk
Yep.
about it more. Is there anything else that needs to come before the board today?
I move to adjourn.
No,
That's
Wait,
sorry.
excuse me.
No,
I do
it's
not.
public comments
Yeah.
today.
It's the third week.
It's the third one. I had to look it up for sure. I couldn't remember. Is there anyone who would like to address the board?
Yvonne Crabtree, Caledonia Township. I didn't hear anything about the, excuse me, highway department building. Is that can just being kicked down the road again? Something needs to be done.
Thanks, Yvonne. As far as I know, that's kind of been put on hold for a little while. I haven't heard anything going on.
No.
No.
The committee has not met, so more or less it's been put on hold.
Anything else?
All right, Steve, your cue.
Okay, I move to adjourn.
I'll second it.
All in favor?
Aye.
We are adjourned.